All right, let's jump right in. If you really want to get a handle on the US health system, you've got to know where the action is. And I mean where most of it really happens. So today, we're going to take a tour of this huge, super important world called ambulatory care. So let me ask you something. When you think healthcare, what's the first image that pops into your head? Is it, a giant hospital, big ER doors swinging open? Well, I've got a feeling the real answer to where most of us get our care, it might not be what you think. Yeah, you guessed it. It's not in the hospital. The vast majority of times you interact with a doctor or a nurse, it doesn't involve checking in for the night. It's happening somewhere else entirely. And that somewhere else has a name. It's called ambulatory care. It's basically the catch-all term for any kind of healthcare you get where you walk in and walk out the same day. Think about it. Your yearly physical, getting a prescription, a visit to a specialist, all of that is ambulatory care. Okay, so here's our game plan. We're going to look at why care left the hospital in the first place. Then we'll do a quick tour of all the different places you can get care now. After that, we'll check out some cool new ways they're trying to connect it all. And we'll wrap up with a big one, telehealth. Sound good? Let's go.
All right, first up, the great outpatient shift. I mean, it sounds dramatic, but it really was. For the longest time, hospitals were everything. They were the center of the healthcare universe. But then, starting around the 80s, things got, well, they got turned upside down. A mix of money and new tech started a huge push to get care out of the hospital.
This timeline really lays it all out. So back in the late 80s, Medicare drops this bombshell called DRGs. Basically, instead of paying for every little thing a hospital did, they started paying a single, flat fee for a diagnosis. All of a sudden, hospitals had a massive incentive to get you in and out as fast as possible. That blew the doors wide open for all these freestanding clinics to pop up in the 90s. Fast forward to the 2010s, and the ACA just pours gasoline on the fire, creating new models that are all about coordinating care outside the hospital. And the result of all that, just look at this number, 48%. By 2016, nearly half of all hospital revenue came from outpatient stuff. That is a mind-blowing jump from just 23% back in 1990. I mean, hospitals had no choice. They had to totally change how they operate and follow the people and the cash right out the front door. Okay, so that's the why. Now for the where. Let's take a little tour of this new world of care settings. Now that everything's not just happening in the hospital, where do people actually go? Well, let's start with the number one spot. And would you look at that? Over half, 54.5% of all doctors' visits are to a primary care physician. This is the absolute bedrock of the system. We're talking about your family doctor, your general practitioner. They're the quarterbacks, really, the first stop and the main guide through this whole complex world. Okay, but what about the ED? The emergency department is still a huge piece of the puzzle, right? Of course, but its role is a little more complicated than you might think. For a lot of people, especially folks without insurance, the ED isn't just for emergencies. It's their main, and sometimes their only, way to see a doctor. And this number right here proves it. Over 40% of all visits to the emergency room are paid for by Medicaid or CHIP. That tells you everything you need to know. The ED is an absolutely critical safety net for the community, making sure everyone can get care when they need it, no matter what. Which brings up a really good question, right? The ED is for, emergencies. But what if it's 8 p.m. on a Tuesday, your kid has an earache, and your doctor's office is closed? Where are you supposed to go? Well, a bunch of new options have popped up to answer that exact question. This table is perfect for breaking it all down. Think of it like choosing the right door. Door number 1, the ED. That's for the really serious, life-threatening stuff. It's got all the specialists, but man, is it expensive. Door number 2, urgent care. This is your middle ground for stuff that's not life-threatening, like a sprained ankle or the flu. The cost is more reasonable. And then you have door number 3, the retail clinic. The little clinic inside your pharmacy? That's for simple stuff, like a strep test. It's the cheapest option, and you'll probably see a nurse practitioner or a PA. Okay, so having all these choices is awesome, right? But it can also get messy. Like, your urgent care doctor has no idea what your primary care doctor is doing. And that brings us to our next section. How do we fix that? We're going to look at some new models that are all about connecting the dots and making the whole system work together for you, the patient. The whole thing starts with changing how we pay for healthcare. The old way was called fee for service. It was basically piecework. The more tests the doctor ordered, the more money they made. It's like paying a mechanic for every single screw they tighten.
But the new model, value-based care, flips that completely. Now the goal is to pay doctors and hospitals for keeping you healthy, for better results, not just for doing more stuff. And that philosophy is the driving force behind this really cool idea called the Patient-Centered Medical Home, or PCMH. Don't let the name fool you, it's not a building. The idea is to make your primary care doctor the captain of your healthcare team, coordinating everything for you for your whole life. So, what does that actually look like in practice? Well, a PCMH is built on these 5 big ideas. First, it's all about you. You're a partner and the decisions. Second, it's comprehensive. They look at your physical and mental health together. Third, it's coordinated. They make sure your specialist and your hospital are on the same page. Fourth, it's accessible. Think shorter waits, maybe even email access. And finally, they're always trying to get better, using data to improve your care. Okay, so that's the PCMH. What's the other big model out there? It's called an Accountable Care Organization, or an ACO. You can kind of think of an ACO as a PCMH on steroids. It takes all those same ideas and just blows them up to a much bigger scale. So an ACO is basically a whole network. We're talking doctors, hospitals, specialists, the whole shebang that all agree to work together. They take on the financial and medical responsibility for a specific group of people, say 5,000 Medicare patients. And their goal is simple. If we all coordinate, we can eliminate waste, stop doing unnecessary tests, and ultimately keep our patients healthier while lowering the total cost of care. And that brings us to our final topic, and honestly, it's the one that's changing everything the fastest: telehealth. This isn't some far-off future stuff. It's happening right now, and it's totally reshaping what ambulatory care even means. Now, when I say telehealth, I know your first thought is probably a video chat with your doctor, right? And that's part of it for sure. But the real definition is way bigger. It's any time we use tech, phones, computers, apps, to support healthcare from a distance. It really comes in 4 main flavors. You've got the one we all know, live video, a real-time face-to-face chat. Then there's something called store and forward. That's like when your doctor snaps a picture of your weird mole and sends it over to a specialist to look at later. Third is remote patient monitoring. Think of a smart blood pressure cuff that sends readings to your nurse every day. And finally, there's mHealth, or mobile health, all those apps on your phone that remind you to take your pills or track your steps. So, when you put it all together, care is moving out of the hospital. We're building these new, smarter, coordinated models. And now, technology is letting us do it all from anywhere. It's all pushing us toward a world where healthcare isn't just something that happens in a clinic. It's continuous, it's personal, it's everywhere. Which leaves us with a pretty huge question to chew on. As care literally moves from the clinic to the cloud, how is our relationship with our own health going to change forever?